There are two releases of NHS pathways each year, and the reason there are two is that it allows services enough time to embed any changes that are required, to ensure that the appropriate training is in place, and to ensure that there is enough feedback on any changes so that they are appropriate to the service that it operates in. There could be more than two NHS pathways releases a year. However, implementation of new releases and changes has an impact on users and organisations in terms of training, in terms of changing ways of behaviour, and it takes time to embed a new system or changes to a system. And rather than having multiple small changes, it is far preferable to have fewer but more effective training and embedding of changes within the system. If through feedback from service users, services that use NHS pathways, clinicians either directly or via their professional bodies, then changes can be made even within a 24-hour period if it is critical. Through that feedback, the NHS Pathways authoring team reviews the content and makes the necessary changes in a timely fashion. There are over 700 NHS Pathways clinical algorithms. They originate from symptoms presented by patients, and the evidence base for processing them is gathered from at least 3 different sources relevant to at least the last 5 years material that is gathered extensively by the NHS Pathways authoring team. The evidence is then sifted to ensure that the right outcomes are obtained in terms of the acuity of the response related to that particular symptom. Each NHS Pathways release is determined by the feedback received, by the changing clinical evidence base and knowledge in clinical activity. The authoring team then puts together a new version which is submitted to the National Clinical Governance Group for review and by the relevant specialties for each particular new or changed pathway. The NHS Pathways National Clinical Governance Group approves the revisions or new additions, and the authoring team then prepares a new version for launch. Thereafter, the new version release is planned with the user sites, with the appropriate training material, appropriate training, monitoring and feedback mechanisms.